Wish you all a very good evening. Can you all confirm whether you all can hear me? Can you all hear me?
Yes, sir.
Yeah, so as much as possible, try to switch to the video mode. Then we can have a discussion. You know, the purpose of this session is to have a discussion. So if you all are in a position to switch to the video mode, can you all do so? So, right. So if you are having any like technical difficulty or background noise, then that is fine. Then I will mute. And at least try to go to the audio mode, right? Unmute yourself so we can have a discussion, right? So you know that otherwise, I mean, we can very easily put this to the system, but the purpose is to have a discussion, right? So at least as much as possible, try to switch to the video mode. If not, unmute and answer. And if that also fails, now you all can send some messages through the chat, right? So we'll keep the interaction in that way, right? You all know so that the purpose is to go for to have some kind of a introductory session with some sample questions, okay, with the view of how to get prepared for the 2025 November exam, right? And keeping in mind that under the new syllabus, now we have had one exam. So it's not something totally new. Now you all have some idea. I mean, from your seniors, you might have heard about some aspects. So keeping that in mind, that is why we wanted to have some kind of a new session, right? So with the experience from the previous exam, right? To discuss about the exam, not to go through the whole content, but anyhow, some selected content with the view of having some kind of a preparatory or introductory or to introduce you types of questions and then some sample questions like that. Okay, so we have a plan in mind. So we'll be having some reflections of the previous exam, right? Then few aspects on community medicine and how to get ready for the exam, and then few inputs on Sri Lankan health system and dengue control, and we'll go into some sample questions based on different types of question formats. Okay, right. So before we move into the from the previous paper, so just a few basic details. Now, ERPM stands for Examination for Registration to Practice Medicine, and that's, have some legal provision as well. So you should know what is meant by ERPM, right? Okay, so as a basic information, and then just to tell you who I am, when we say different specialties, now we call the different specialists by different names, right? So you know that consultant in medicine is called a consultant physician, right? So consultant in surgery is called a consultant surgeon. So gynecology and obstetrics, visiting obstetrician and gynecologist of EOG, right? Then pediatrics, pediatrician. So likewise, rheumatologists, cardiologists, so different specialties, in different specialties, different consultants are there. So I am a specialist in community medicine, right? So if you do postgraduate training in community medicine, then you have to do some exams, MSc in community medicine, MD in community medicine, and after the relevant exams, you have to do some kind of overseas training period, and then after coming back from the overseas training period, you get something called board certification in Postgraduate Institute of Medicine in Sri Lanka. So after that, you become a consultant. Okay, so I'm a consultant in community medicine. I usually don't give much introduction. No, I mean, don't spend time introducing myself. But if you have any more information you want to know, you all can ask more details, and then I will tell. Right. So I mean, for the time being, it's just that. I mean, I'm a consultant a board certified specialist in community medicine, I think that will be fine. And then as and when required, I can relate more details if anyone needs, right? So then if we move into the exam format, right? So I know that you all are aware, because I mean these guidelines are in the SLMC website. So go through those. And just to tell you that when we compare the old format and the new format, so in the new format, we have in the paper 3, right? There's part 1 and part 2, and then under part 1 for community medicine, you will under the new format you get 16 true false type of MCQs and 18 single best answer questions, right? So other things clear up to now? Other things clear up to now? You will have to unmute and talk, right? Other things clear up to now?
Yes, sir.
Okay, so everyone respond now. Now we will put this to the system for the benefit of the people who are not joining live. So I usually like to have live classes, right? So I always prefer, the problem is that students prefer recorded versions, right? Maybe that they can go through them when they have time, or maybe some people little bit stressed when we asking questions, right? So don't worry, I mean any answer you give we appreciate and acknowledge. And it's always, I mean, when you have the opportunity for any subjects, try to attend the live classes, right? Then if you have any query or anything, you can get those sorted, right? Anyhow, but since we know that you have some more other subjects also, so then I mean, all of you might not get a common time slot to attend a live class. So in that regard, the main aim is to get through the exam. So in that case, it is fine. But as a general principle, if you have the option, attend the live classes as much as possible, right? So just to tell you, we know that I told you the purpose of this session is to have some kind of sample questions, and also to get an idea about, general concepts about exams. I mean, community medicine exam, and also to discuss like our plan and those kind of things. So if I show you the difference between, now we told that for the community medicine, there are true false type of MCQs and single best answer questions, right? So if I show you this question, I always like to have the interaction, right? So that's why I ask you all to switch to the video mode or to talk, right? So if you are not in a position to move to the video mode, then at least you will have to speak, right? Unmute and speak, right? So can someone read this question? Can someone read this question? No, very easy. No need to tell the answer. Just read the question. Yeah, can someone read the question? Now we can have a better discussion if you all interact, right? You all can go through this session. Yes, read the question.
Which of the following diseases are notifiable diseases?
Okay.
TB,
Okay.
measles, malaria, dengue, leptospirosis.
Okay, so thank you. So like that, I mean, others also try to unmute and speak, right? Then we can have a better interaction. Now, we told you all know that. I mean, what I wanted to show you is that not the content of this question, right? You will learn about notifiable diseases and what are notifiable diseases, what are not. But here, I mean, at the very beginning, I wanted to show you what is the true false type of MCQ and what's the difference between that and the single best answer questions, right? So, in true false type of MCQs, you get 5 responses, right? And then you see that each response we have to mark as true or false, right? So either all may be correct or all may be incorrect, or some may be correct and some may be incorrect, right? So now you will learn that. I mean, when we do the when we do the when you go through the sessions, you will understand that this TB, malaria, measles, malaria, dengue, leptospirosis, all are notifiable diseases. As I told you, I mean, since we didn't discuss about the notification system and the notifiable diseases, I just told you that all the responses here are correct, right? Here the purpose of showing this was to show you how does the true false type of MCQ appear, right? So in that case, what you have to judge every response independently, right? So response A may be correct. Irrespective of whether A is correct or not, you have to judge whether B is correct or not, right? I mean, it's not like, I mean, if the A is correct, B is not correct, there's nothing like that. Independently, you have to assess the response and answer. So are the things clear up to now? Are the things clear up to now? Are the things clear up to now? Respond. So at least send through the chat. Then I don't know whether you all are getting what I'm telling.
Yes, sir.
Okay, right. Right. So in contrast to the previous question, you can see that this is an example of a single best answer question, right? Now let's say what is the most appropriate service for a 40-year-old lady with a breast cancer? I mean, what the most appropriate service a 40-year-old lady with a breast cancer can get from Well Women Clinic? So there's some clinic called Well Women Clinic where we like, I mean, the primary target group is 35 and 45-year women, right? But you know, anyone who is coming with a reasonable request also can get the services, right? So if you go through the responses, right? So now it says HPV vaccination, hypertension medication, cervical cancer screening, blood cholesterol level, and OCP pills, right? So if I show you like, you know, how to demarcate, how to determine the responses out of this, now you need to know what is meant by HPV vaccination. So there's something called human papilloma virus vaccination. And what you have to know that for which age group we are offering that. So you might have heard or you will learn that we are offering that to grade 6 children. Okay, so grade 6 children, we give 2 doses 6 months apart, right? So hypertension medication, so then that response is apparently, you know, not the best one for the time being, right? Then if you go through hypertension medication, so hypertension medication, you know, we don't start medications from the Well Women clinics. It's kind of a screening clinic. So that is also out, right? So from, you can understand that from some hints, we are excluding incorrect ones because we have to go through the single best response, right? Cervical cancer screening. So we know well from the Well Women clinics, pap smear. Okay, pap smears are done for cervical cancer, and that is a type of service that we offer from Well Women Services. So that is apparently okay. Blood cholesterol level. So there's another type of a clinic called Healthy Lifestyle Clinic. Okay, where this woman, like I mean, age group wise can attend. And where investigations, blood investigations are also done, but it's not the Well Women Clinic, it's called the Healthy Lifestyle Clinic. So that is also out. Then OCP pills, oral contraceptive pills, is, you know, kind of a contraceptive method, but they have given what is the phrase that is mentioned here telling that the fifth response is not correct? This woman is having some condition. What is that condition?
Breast cancer.
Yeah, so that one is having breast cancer. So you will learn that for breast cancer, oral contraceptive pills are contraindicated, right? So then the E also incorrect. So you can see that HPV vaccination we excluded by the age group because HPV vaccination is given for grade 6 children. Hypertension, the response hypertension is excluded by the fact that from the Well Women clinics, we don't start medications, right? It's kind of a screening clinic, and where high risk people we find and do the appropriate referrals. Cervical cancer screening is apparently correct. So blood cholesterol level from the Healthy Lifestyle Clinic, not the Well Women Clinic, and OCP pills. not the suitable answer because of the breast cancer part. So then what is the seemingly appropriate response for this? A or B or C or D or E?
Answer C, sir.
Yeah, so answer C is the apparently most appropriate one. Okay, so I just want to show you the difference between true false type of MCQ and single base answer, right? So if you now you understand, you all saw that now we are discussing about the previous exam, right? Some reflections, right? Then a type of question that most people ask is, you know that I mean, what is the syllabus and you know what to study? Okay, you know that now you all are going to be intern medical officers after this exam. So there are some content that intern medical officer should know about community medicine while doing internship. Okay, so what helps you to be a good intern or to do your services as an intern, you should know under this, I mean, as the content of this subject, right? So just to give you a brief understanding, like, I mean, in 2012, around 2012, in the SLMC website, there was some kind of a draft syllabus that was put, right? So you can see that there were 7 areas. Now these were downloaded from that website. That was a public document, right? That time. So I mean, the first component was describing the concepts of health, like what is health and what is primary health. Yeah, like that. I mean, it's still applicable now, up to now also, right? Then about public health services, what are the central level, provincial level, district level, and divisional level services, and then what are the duties of medical officers of and can you all see the PowerPoint presentation? Can you all see the PowerPoint presentation? Uh, respond. Can you all see the presentation? Okay, right. So, okay, right. So at least, I mean, through the chat, you all reply, right? Otherwise, I don't know whether you all are getting what I'm telling, right? Yeah, right. So then these kind of this organization of public health, central, provincial, district, and divisional level, and then MOH services, public health inspectors, public health nursing sister, public health midwife. I mean, regarding the staff members and different institutions, right? And then epidemiology. Then third component was epidemiology and statistics and control of communicable diseases, right? So under this one, epidemiology, definitely, I mean, anyhow, there are questions always, right? And then control of communicable diseases, definitely there are questions. Statistics, there was some kind of variation, right? You know, at the very beginning, there were many number of statistics questions, and there had been some years where statistical questions were not there. So some students tend to, you know, omit statistics and get rid of other subject, I mean, other content. But, you know, it is a waste of marks, right? So statistics, there are some basic concepts, and if you are clear about those basic concepts, then you can score the fullest, okay, the maximum marks. So what we do is, I mean, the essence of the statistics and epidemiology that you should know, we are covering, right? So if any question on statistics or epidemiology, like let's say now you may have seen that, you may have heard that there were questions on case control studies like that, I mean, different study designs and all. So all these and screening, right? What screening test, the applicability of screening tests, and those kind of questions you all can very easily answer when you have those concepts in your mind. Okay, so those things that we will be covering in this series, right? And then maternal and child health services and nutrition, definitely questions will be there. And then environmental and occupational health, and also health promotion and education. And then there was some recommended reading material also that they have recommended at that time. Okay, so now since you all are having other subjects also, right? So what we are doing is, I mean, in this series, we'll be covering the relevant content of this, the recommended materials also, right? so that, I mean, if you all do what we discuss in these sessions, then that will be fine, and then we will be covering the whole content. I mean, okay. So as I told, I mean, there is no hard and fast strict syllabus that has been shown, but keep in mind that whatever the services that whatever the level of knowledge that is required for an intern medical officer in relation to community medicine, you all should know. Right? So those are covered in these sections, and as a guide, we went through some previous content that was shown in the SLMC website, right? Okay, so what we are doing is, I mean, we'll be covering all these things in this series. Now, if I give you some examples, let me give 2 examples, right? Now, if you say we are going through 2 sample questions, right? True or false type of questions. If you don't know the content, that is fine. I want to stress something out of these questions, right? Now it says, which of the following is or are true regarding maternal and child health services, right? School medical inspection is done for grade 10 in a school with 400 total students, right? Now, since you all are not speaking, let myself give the answer, right? But you all are warmly welcome to speak at any time, and the more you talk, the better, right? Then we can keep the interaction. But since you all are not talking, I am telling, right? But if there's anything that is not clear, you all answer. You all ask anytime. Right, so there's something called school medical inspection that you will learn, okay, that we do annually. Okay, there's some demarcation called MOH system, Medical Officer of Health system, and under every Medical Officer of Health area, the schools, for the schools that are within the Medical Officer of Health area, that Medical Officer of Health office is doing school medical inspection for all the schools in that geographical area. There's a slight demarcation, especially in the Colombo Municipal Council area, that we will do that in detail later. But generally, the relevant MOH office will conduct something called school medical inspection, where the children are examined clinically. Okay. And then when there are more than 200 students, we do this SMI in grade 1, 4, 7. And this question is asking whether grade 10 is correct or not, right? So the answer was that some years back, grade 10 was not included, but now grade 10 is included, right? So if you were referring to some old notes, somebody might mark this as incorrect, but actually this is correct. Okay, and then a low-risk pregnant mother is expected to go to the field clinics once a month up to 28 weeks. Now, some may have heard that up to 28 weeks, pregnant mother should go to the clinics once a month, then from 29 weeks to 36 weeks, once in 2 weeks, and then after 36 weeks, once a week until delivery, like that. That is a very old system. Now we are not following that system, right? So somebody who might have gone through previous notes might think this as correct, but actually it's not correct, right? Then pap smears are repeated every 5 years. Okay, pap smears are repeated every 5 years. So that was the practice until some years back. Okay, we asked the people to come to the well women clinics when they were 35 and asked to repeat the pap smear 35, 40, 45, 50, like that. But now it is different. Now it is 35 years and 45 years. Okay, right. Then that is also to show you that there are some timely revisions that have been done. And then vitamin A megadose is given to all school children. Again, some years back, this was correct. Now incorrect. Okay, now routinely we don't give vitamin A megadose, but if you are referring to some old notes, you might get this as correct. Right? Okay. And then, okay, so there's query asking whether we can share the questions. Yeah, don't worry. I mean, we will share this video in this system. You all can go through this freely. But the purpose is not just to go through these sample questions, because there's many more questions, and today the purpose is go through some sample questions and get an idea regarding the basic concepts. Okay. So we will put this video and this will be something free, right? So anyone can go through anytime. And these questions, anyhow, we are going to elaborate and we will be covering in the relevant sessions. Okay. So today, get the things, get the principles into your head, right? So deworming treatment is given to all pregnant mothers. That also correct some time back. Now, not correct. Okay, we don't give routinely now to all areas. So all these 5 responses, there's one concept that we wanted to highlight. What is that concept? What is that concept? Now, since you all are not talking, I am telling. The thing is that, whether the statement is correct or not changes according to the time period, right? So that is why some people get some responses incorrect, or some people might go home telling that I answered this number of responses and then I'm expecting this amount of marks, but there may be some timely revisions. All these 5 statements were either true or false in one period of time, and then compared to the current status, right? The opposite answer was true sometime back. Then question number 2, similar example. Which of the following are true of EPI vaccination schedule, right? EPI means Expanded Program of Immunization. That is the national vaccination schedule in Sri Lanka, right? Japanese encephalitis is given at 9 months. Sometime back true, now false. Now we give JE at 1 year. MMR first dose given at 1 year. Sometime back it was correct. Now false. Now we give that at 9 months. A killed polio vaccine is given. Now correct. Some years back false. Right? That time there was only live vaccine was there. But now we are having live vaccine as well as a killed vaccine. Then rubella vaccine given to grade D students some years back, correct. We used to give. Now we are not giving. We give now rubella as part of MMR vaccine at 9 months and 3 years, right? 5 doses of polio are given. Sometime back true, now false, because there are some 2 killed vaccines also we give as fractional IPV. So now it's not 5. We give 2 additional doses at 2 months and 4 months. So the currently correct responses for question number 2, okay, the opposite of those correct responses were true some time back. Are you all getting what I am telling? So are the things clear? Respond either with a message or verbally or whatever way. Are the things clear?
Yes, sir.
Okay, right. So what I want to highlight is that community medicine, unlike other subjects, is very dynamic. That is why you see for medicine, surgery, gin of speed, psychiatry or anything, there are many textbooks, right? But for community medicine, you hardly get any textbook, right? There are some books like, this Park and all, where they talk about some basic common stuff, right? So, but that, there's no universal textbook for community medicine. For some components, there is like, statistics. Those are, relatively, they are fixed anywhere, right? If we ask chi-square test how to apply, it's the same way that we apply in Sri Lanka and in USA. But all other things, these vaccination schedules, the antenatal mothers services and school medical inspection. Okay, and even this MOH system, you don't find in many other countries, right? So, and this, so the system in Sri Lanka is different from other countries. And you can see even in Sri Lanka also, you see that the system is ever changing, right? So that is why, now if I tell you some more examples, there are some changes done to the circulars and guidelines, and there are some special programs like supplementary immunization activities, special vaccination programs, and changes in the indicators like measles, mumps, like maternal mortality ratio, right? Every year maternal mortality ratio will be different. Every year crude death rate, crude birth rate will be different, right? And then reasons for mortality will be different from year to year. And then there are changes in the service delivery, right? Like now, if you get Colombo, there are some areas called MOH areas all over the country that we are going to discuss, right? So if we say few MOH areas like should say Battaramul and Kaduwela. Some years back, those two belong to one MOH area. Now divided into two as Battaramula Kaduwela. And then there are two MOH areas called Morotua and Negoduyena, now regarded as two, but those days one, right? And there's a new MOH area called Port City area, is now regarded as a new MOH area, right? Recently declared as a new MOH area, right? So some time back, there was no MOH area called Port City. Okay. So that is why different many changes are happening. And there's a staff category called public health nursing officer, not the public health nursing sister, right? So public health nursing sisters were there, but public health nursing officer is kind of a new staff category. And then there's another staff category called Madhuru Mardana Sahayaka. Okay, in all the MOH areas, right? They were not there some time back, and they are not there in other countries. Okay, so everything is many things are unique to the Sri Lankan system, and even within the system, things are changing. So that is why these things are very much dynamic, and that is why you should get your knowledge revised in community medicine, right? So are the things clear up to now? Are the things clear?
Yes, sir.
Okay, right. So everyone respond, right? Then we can have a better discussion, right? Then this our discussion, I mean, when we are having a comprehensive discussion, when we put this to the system, then other people also will get benefited, right? There are many more who have not joined this live session. As I told, I mean, they are happy to go through these recordings, right? But again, I am telling as much as possible, join the live sessions, right? So our aims in this series, now we have a primary aim. What is the primary aim? Getting through the exam. Okay, to help you get through the exam. So that is the primary aim. And there are secondary aims, like, to give you adequate knowledge about community medicine and, to inculcate favorable attitudes like that. But all these are secondary. Primary aim, your primary aim and our primary aim is to help you to get through the exam, right? And then the materials. Now you know that we have a system, and then you all can go through the videos in the system at your leisure. I mean, whenever you all are free. And in addition, in the system, there will be some PDF documents that you all can get and get printouts, right? So in the system, the things that we discuss in the system are congruent with that note. Okay, so there will be some interactive things that will be done in the videos, like, there may be some blanks that are there, so you can fill them when you are listening, when you are going through the video. Okay, so why we are keeping some blanks and filling sometimes, because even from the research, it has been proven that rather than just reading something, if you are kinesthetically involved, right? If your muscles work and you write some notes, something like that, then the memory will be more. The amount of things that you remember will be more. Okay, so we use different materials. There will be audio visual material, there will be hard copies. Okay, there will be summary notes. Okay, everything will be in the syllabus. And then before showing you like our plan, just to tell you that I was telling that I make you go through 10 responses that have the exactly opposite answer now compared to the correct answer sometime back, right? And to highlight that more, let me tell you that compared to the last exam, okay, now your seniors, now when they sat for the last exam, now there was some system. Now only few months have gone, right? Now even within that period also some changes have happened. Like there's something called multiple micronutrients that we give for pregnant mothers, right? Non-anemic pregnant mothers, right? And currently we are considering whether to expand that to the anemic pregnant mothers also. So maybe by the time that you sit for the exam, that change may happen. And there's another example, chikungunya, right? So chikungunya is caused by Aedes mosquito like dengue, right? So chikungunya was not in the notifiable disease list, but currently it has the chikungunya cases are notified by a special circular, right? So these changes happen. So that is why now we can't simply do some recordings and put to the system and let you go through them, because some of the things may be little different when you go for the exam. So keeping that in mind, what we do is we have under this theory component, we have 10 sessions, right? So those 10 sessions you can go through when you are free, and those will be in the system, right? But I told you during few months also several changes have happened, right? So there may be many changes in another 6 weeks. So that we will be putting, after some time, we will be recording 2 sessions, session 11 and 12, and we will put those 2 onto the system. And you all can go through those 2 sessions after you go through the first 10 sessions. And those 2 sessions will, will highlight or will enlighten you on the newest changes that had been done. Okay, so before your exam, you will be 100% updated, right? Even not you are not out of dated even for several months, right? You will be up to date, right? So that is our plan, right? So that is for the theory session, right? And then in the system, there will be another series for mock papers, right? So in the mock paper series, there are 10 sessions, and in the 10 sessions, 15 mock papers are covered, right? So in the 15 mock papers, like there will be true false type of MCQs as well as single best answer questions, right? And there will be addition, like in this theory session where the new changes will be done, new questions will be added to the system, right? So by the time you go through the by the time you sit for the exam, whatever the changes that have been done, the questions on those, and then getting experience from the previous exam also, some new stuff will be added to the system, right? So that is our plan. I mean, we have a theory series and we have a mock paper series, right? And then after the exam, there's you all sit for the OSCE exam, right? And the format of the OSCE. So there will be 18 stations and 2 will be from the ComEd, but in the guideline also it has been mentioned. I mean, some of the stations may be mixed. So even though it is 2, I mean, some of the other components also will be from this, right? I mean, you can answer from this knowledge. So that for that, we have 4 sessions in the system, but you all can go through those after completion of this part 1, right? So we know that. So if I show you again, this part 1 include this. Part 1 include this single best answer questions and the true false type of questions, and then after that you can focus on the OSCEs, right? Okay, so that is our plan. So are you all clear about the plan now? At least send through the chat whether you all are clear about the plan and what I told up to now. Are you all
Yes,
clear?
sir.
Okay, right. Now the more you all respond, the better discussion we can have. Huh? Right. Then let me tell you some facts about community medicine for about few minutes, okay, before we move into some more questions, right? So some of you may be thinking that community medicine is a very boring subject where you learn about only statistics, epidemiology and all, but no, that is incorrect. Now, COVID-19, okay, so that we got the first case 2019 December, and then now we developed vaccines, and now the impact is minimum now. Now there are no restrictions overseas travel, but sometime back there were lockdown areas, and then travel restrictions and all. And we all were wearing face masks mandatorily and all. Now it's optional, right? So in all this process, the whole world realized the importance of community medicine, right? So the community medicine people, staff members related to community medicine were involved in, these investigations, contact tracing, vaccination, and then data management and development of the guideline and all. So that is an ample example of the value of the community medicine. Now, if I show you another example, now let's say that there's a bridge. And then when people are moving across the bridge, let's say some people fall into the river, right? This happens frequently. So one type of management would be to, to look after these casualties, quickly take these people to the hospitals and all. So that should be done. But if you keep on doing that, what will happen? More people will fall into the water, right? So what we should do is, while caring for the affected people, we should take measures that the bridge will not break. So people will not fall, right? So that is an example where community medicine comes into practice. We don't only focus on cure, we focus on prevention also, right? So that is very much cost effective, right? So that is one principle there. And the services that we offer, we can broadly divide into two, right? One is, so whatever the questions that you all are getting also from these, right? Based on these concepts, right? So one type of questions under community medicine that you get is called maternal and child health services. That is services for women and children, right? So you know that there's a life cycle, okay? Starting from pregnancy, then newborn is there, up to 28 days we tell neonate, up to 1 year we tell infant, up 1 to 2 years we say young child, 2 to 5 years we say preschool, then from 5 to 19 years we say school age, right? 10 to 19 we say adolescence, right? Okay, so like that, I mean, there are several stages of the life cycle, and according to the each life cycle stage, there are services that we deliver. Antenatal services, postnatal services, vaccination services, well-being services, family planning services, okay, gender-based violence prevention services, okay, growth and monitoring services, right? So many, plenty of services we offer. So those services can be grouped under life cycle-based approach services, okay? And those are maternal and child health services. And then there are other services like disease prevention, both communicable and non-communicable disease, right? And then environmental health, right? Examples include food safety services, water quality services, waste management services, disaster management services, occupational health services, health promotion services, and health planning concepts, right? So this is the second type of service that we can divide the services of community medicine, right? So all these, I mean, both of these types, life cycle based services and these other services, are reflected in the content that I showed you under the community medicine, right? All the questions will be based on these, right? What should the intern medical officer know in relation to the life cycle based approach, and what should the intern medical officer know about communicable disease control, non-communicable disease control, food safety, water quality, waste management, disaster management, occupational health, health promotion, like that. Okay, right. Then few more things about the syllabus, and we told the content. Now how to get ready for the exam. Some people, they prefer going through the past questions and, learning from that. That is why, I mean, we also sometimes get some people asking, can you do this, I mean, some uh, questions like that. I mean, anyhow, we are doing questions. I mean, the past questions, some are very much interested in that, right? So if you get the syllabus, now for any exam, you should know that paper will cover some component of the syllabus, right? For an example, if you say this yellow colored box is the syllabus and these circles cover some component of the syllabus, right? But you see that there are some uh, areas that are not covered in the past papers, right? So, I mean, the danger of only going through the past papers is that if there are any new kind of questions, then you might be in trouble. And also there might be some questions that compare different areas of the syllabus, right? That is why, I mean, it is not only enough to go through the questions, but I mean, definitely you have to go through the questions, right? For any exam. At the same time, you need to know about the content in the syllabus also, right? Okay, so that is the importance. So you have to know the content. So that is why we do both content and the syllabus. Now again, if you do a research, I mean, when we do a research of people who unfortunately were unsuccessful in any exam, right? People who were unsuccessful in any exam, 15% of them, now they didn't do anything, right? they haven't done anything. So you know that they also know that they deserve that result because they did not prepare well. But 85% of them prepared well. The thing, what happened was that the method that they got prepared was not correct, right? Okay, so if we tell an example, now let's say now these days, you know, this term is there, the superstar competitions. Now what happens is that uh, when uh, when someone wants to be a superstar, now they perform in front of some judges, right? I mean, there may be some SMS or whatever component also, but you know, I mean, then different people may get ready, may practice using different time periods. You know, someone will do some practice session of, let's say, 20 hours, someone will be doing 5 hours. So you can't go in front of these judges and tell that I practiced for this number of hours, so I need to be the superstar. No, I mean, they will judge you on that day's performance. Exam is also like that. You can't think that since I dedicated or I studied for this number of hours, then I should get this amount of marks. The amount of marks you get may not be directly proportional to the hours you spent on studying, because it is not the quantity of hours of studying, it's the quality of hours of studying that is important, right? Keep that in mind. And exam is also like that. Okay, it's about the way that you perform at the exam. Okay, it's about how you perform at the exam, because the examiners will judge you based on whatever the response you give for the exam. They will not ask how many hours you studied like that. Okay, so keep that in mind, right? So it's about quality of exam. So I mean, there are several things. I mean, you have to keep the place that you study pleasant. Okay. And you know, there are some ways of learning. Some people are visual learners, right? Visual learners means they see the things and learn well. So for them, these videos will be very much beneficial. So they will look at that and learn. Some people will hear. Okay, so they will memorize more when they hear more. Some people will be kinesthetic. I was telling that. So most people will remember more when they use some muscles also, right? So that is why we, either you are a visual learner, auditory learner, or kinesthetic learner, you will benefit from the way that we are doing, because our notes, if you go through that, you have something to write on them also, right? While listening to the videos, you will have to write some of them, and these things we'll discuss later. I mean, you have to manage your time. So we are very much aware that you have many other things to do, you have many other subjects to study. Some of you may have all the subjects, some of you may have some of the subjects, right? So we are very much vigilant. That is why we will make you spend minimum time for community medicine, provided that you attend to the sessions with full focus. Okay, so if you listen to the things, if you go through the things, if you answer the things, okay, so then that will be enough, right? So you can ask from your seniors, right? We spend minimum amount of time. So that, I mean, there was just theory uh, sessions, 10 theory sessions, and we'll be adding 2 more. We told that for the new revisions, and then 10 sessions for mock papers, and we'll be adding few more, like few more papers. And then after that, TOSCI 4 sessions, right? So we have we are very much concise, right? So summarized, we do summarize, concise, and focused and specific way of discussion. Okay, to make you have more time to get ready for other subjects. Okay, but the little amount of time that you spend on community medicine, you have to focus 100%, right? Okay, so there will be many things, there will be comparisons, we will be discussing about new things, right? Okay, and you get some like you can talk to some of your seniors and see, right? Okay, so that you also, right, that we also are aware, and you also try to categorize the things that you have to study and things that you have to do as important or not important, and urgent and not urgent, right? So important and urgent things in the first quadrant, important and non-urgent things in the second quadrant, not important but urgent in the third quadrant, and not important, not urgent in the fourth quadrant. But you know that, I mean, you are not machines, you are human beings, you have parents, you have siblings, you have partners, you have children, you may have children, relatives, neighbors. So there may be some commitments that you have to make in your day-to-day life, right? So the ERPM is not the only thing in your life. Okay, you have to enjoy life, you have to deal with other people, you have to ensure your social well-being is optimum, right? And you have to ensure that your mental well-being is optimum, you have to ensure that your physical well-being is optimum. Okay, this ERPM is not your world, is only one part of the world, right? Otherwise, you will be in trouble, you will not enjoy. So that is why try to have some quality time of preparation for ERPM. So you will be having more time to the other commitments of your life. Okay, so that's one advice we want to give, right? Right, and then there is some shortcuts, all those things we will do, right? So then now let's move into some two brief theoretical sessions to go through some of the questions. Now, before going through the questions, I'll just summarize few of the theoretical content, and then we will go through the questions, right? Okay, now when we say dengue, I want to just summarize, I mean, to show you some of the differences between this true false type of questions and single best response, how to get the answer for those using an example. Okay, so let's get dengue as an example. So you know dengue. Now, if you compare dengue with COVID, dengue fever, we have many patients every year. Okay, COVID started in 2019. Now very much less impact. In 5 years, we developed vaccines, and then we we ensured that its impact on our life cycle is minimum now. But dengue, every year dengue cases. So why, having known in and out about dengue, why can't we control dengue 100%? The reasons we can categorize into three. Why dengue virus related factors? There are 4 serotypes of dengue. Okay. Because of the 4 serotypes, one person can get dengue fever multiple times. And also developing a vaccine is challenging. And there are many more mosquito-related factors. You know that dengue virus is the agent responsible for the disease, whereas mosquito is the vector. Vector takes the virus from one person. I mean, mosquito gets the virus from a dengue patient and then put that into other people, right? So that they become dengue patients. Now, there are many factors related to the mosquito that makes dengue challenging to control, right? One example is life cycle. It takes only about 7 to 10 days for the adult mosquito to occur from the egg. Only 7 to 10 days, right? And little amount of water is sufficient. And after becoming an adult mosquito can live for a lifespan of median of 21 days, right? Median is 21 days, right? And then one female mosquito lays 100 to 200 eggs per time. And these eggs can survive without water also for 1 year, right? And then the fly range. Mosquito can horizontally fly for a radius of 200 meters. So radius 200 meters means diameter 400 meters, right? Then peak biting time or peak active time, unlike other mosquitoes, is when the sun is coming and when the sun is setting, right? So 6 to 9:30 a.m. and 3 to 6:30 p.m. That's the time children go to schools, have morning assemblies, people go to work, and people come back, and children play in the evening. So all people are exposed to dengue mosquitoes, right? Then dengue mosquito prefers humans than animals, whereas some mosquitoes prefer animals than humans, right? And dengue mosquito gets the virus after biting a dengue patient, and throughout the life cycle of the dengue mosquito who is with the virus is infective throughout the life cycle, right? So those are some of the factors that makes dengue a problem as far as the mosquito is concerned. And then environmental wise, our country, the temperature of Sri Lanka is ideal for mosquito breeding. And there's a water collection tendency because we are an agricultural country and we have higher population density like in the Western province. And about 50% of the dengue patients in Sri Lanka are found in the Western province because high population density and other favorable factors, right? So those makes dengue a challenging disease to control, right? So if you get the life cycle from the eggs, there's larvae and then adult mosquito. So when we want to break the life cycle, we can either go for prevention of breeding places and then larval control, which may be physical, chemical, and biological in methods. And then adult mosquito control by fogging, you know that Dumagahana, what we say, right? Okay. And then indoor spraying and insecticide treated nets, and we can prevent mosquito human contact, right? So with that background, let's move into some questions. Now you all answer these. Can you all unmute and answer? Otherwise, only I'm talking, right? Which of the following are true of dengue or dengue control? Agent is Aedes mosquito. True or false? Now these are examples of MCQ true and false type of questions, right? So agent is Aedes mosquito. True or false? Can you try? Agent
True,
is
sir.
so when we say agent, agent is the, in Sinhala we can say roga karaka, right? So we have an agent who causes the disease and vector who may spread the disease. So mosquito is agent or vector? Mosquito is agent or vector? Yeah, mosquito is a
Vector, sir.
vector. Yeah, mosquito is a vector. So who is the agent? Dengue virus is the agent, right? So the first one is false.
Virus.
Two, yeah, so two serotypes are found. So two serotypes, so how many serotypes are there? How many serotypes are there?
Four.
Four serotypes. So this is false. In the elimination phase in Sri Lanka. So that is false. Now elimination means we have controlled the new cases. Okay, there is only risk of new cases. So in malaria, when you get malaria, we are in the we have, let's say, eliminated. That means there are no endogenous cases of malaria. We have malaria. You now recently also you may have seen in the television that they were telling that there are some malaria cases. So those are cases that occurred with the people with a travel history. Okay, no transmission within Sri Lanka. Okay, so malaria in the elimination phase, but dengue not, because dengue, we get many cases. So there's a difference between the terms control, elimination, and eradication that you will learn, right? So third one also false. D, around 10,000 cases are reported annually in Sri Lanka. No, I mean 30,000, 50,000, no, even more, right? So false. Dengue virus, dengue vaccine is used in Sri Lanka, so false. So we don't currently have a dengue vaccine. Some countries have commercial preparations of the vaccine, but in Sri Lanka, we don't use that. Okay. Up to now. So which of the following are true of secondary prevention of dengue currently in Sri Lanka? So you see now to answer this question, you need to have an idea about what is secondary prevention, right? So there are different levels of preventions: primordial, primary, secondary, and tertiary, right? Primordial means we want to prevent the occurrence of the risk factors at the societal level. Primary means we want to prevent the person getting the disease. Secondary means we want to prevent complications. Okay. Tertiary means complications have already occurred and you want to minimize the disabilities. Now here they are asking about secondary prevention. Secondary prevention means we want to prevent complications. What can we do to prevent complications? We have to detect any disease early. We have to treat the disease early. We have to refer the relevant people. So early detection, early treatment, early referral are examples of secondary prevention, right? So measuring temperature is secondary prevention, true, because then we can detect fever, and when we detect fever, we can, go into detect dengue with further evaluations. So that is correct. Correct fluid balance. Yes, we have to do the correct fluid balance, okay, in order to, prevent shock or overload, right? So if you get shock, then fluid overload, then that is a complication. So we are utilizing correct fluid balance to prevent that complication. So that is secondary prevention, true. getting non-steroid anti-inflammatory drugs, you know, non-steroid anti-inflammatory drugs are contraindicated in dengue fever falls. So that's not a preventive method. That is something we should not do. Okay. Right. Then blood count after 48 hours. Yes. That is for early detection. Doing exercises, you know, when you are suspecting, when someone is suspected of having dengue, we tell them to get some adequate rest. So we don't do exercises when someone is having an illness. Okay, acute communicable illness like this, right? Okay, so that is false. So you can see how to select the answers. Then, which of the following are true of fogging for dengue? Belongs to secondary prevention. So, you know, fogging we do to kill adult mosquitoes. Okay, so it's not secondary prevention, right? Aims at preventing the person getting the disease. So, you know, when we do fogging, it may prevent the person getting the disease. So, I mean, it can happen as a primordial prevention or primary prevention, right? Is done in pathogenesis phase. Now, don't worry about these individual responses. I am telling you some concepts, how to work out the answers, right? Is in the pathogenesis phase. Now, when we say pathogenesis phase, these four preventive methods, prevention levels that we told can be divided into two phases, pre-pathogenesis phase and pathogenesis phase, right? Pathogenesis phase means the things that we do when the disease is there inside the body, right? So when you are having dengue fever, nothing will happen by fogging, okay, for that person. It will prevent others getting dengue, right? Okay, so it is the fogging is a method in the pre-pathogenesis phase. Okay, not the pathogenesis. So then C is false. Included in rehabilitation. Rehabilitation is an example of tertiary prevention. That is after getting the complication. So fogging will not be of any benefit to the dengue patient per se. So it's not in the rehabilitation phase, right? Then aims at minimizing complications. So complications also we want to minimize in the pathogenesis phase, right? So that is secondary prevention. Secondary prevention belongs to the pathogenesis phase. Now fogging is not in the pathogenesis phase, right? So likewise, you need to think and decide now what are the levels of prevention and what we do from fogging, so that fogging is related to this level of prevention, like that. Okay, don't worry about the individual responses. You will learn them through the system, right? All these things will be covered in detail, right? What I am telling now is now how to work out the answers, right? Which of the following are true of primary prevention of dengue currently in Sri Lanka? So primary prevention is preventing the person getting the disease. Mosquito nest, true. Okay, person will not get mosquito contact. Exercise, you know, exercise is good for prevention of non-communicable diseases, but it's not a protective factor for dengue, right? I mean, indirectly, maybe yes, person may be healthy and there will be good immunity and all, but you know, directly not a primary preventive method. Immunization, currently we are not having a vaccine. Prophylaxis, we don't have dengue prophylaxis drugs. Health education, yes, I mean, we can do that as a primordial prevention method, right? So like that, you can work out the answers from this, right? Now let's go for a single best answer question example from dengue. Which of the following is the best statement on dengue? In Sri Lanka, mortality of dengue is relatively low. In Sri Lanka, morbidity and mortality of dengue is relatively low. In Sri Lanka, mortality and morbidity of dengue is relatively low. In Sri Lanka, mortality of dengue is low and morbidity is high. In Sri Lanka, morbidity from dengue is low. Right. Now, single best answer questions, the issue is that sometimes you may find a direct question which is correct. Now, here it is, the last one should be high, right? Okay. So, sometimes there may be an obvious question where other four will be obviously false. Now, in this example, things are a little bit complicated. Now, let's get, because all the statements are having similar kinds of words and you have to work out now, right? Now, in Sri Lanka, mortality of dengue, okay, that is deaths due to dengue is relatively low. That is true. Our case fatality rate of dengue is relatively low. So, first statement is correct, but we don't know whether there's a better statement. Let's see. In Sri Lanka, morbidity and mortality of dengue is relatively low. Our morbidity is not low. Morbidity means, let's say, except for death, other burdens. So the number of patients, example, go under morbidity. So we know number of patients are high. Okay, so morbidity not low, mortality is low. So second one not correct. In Sri Lanka, mortality and morbidity of dengue is relatively high. No, mortality is not high. So third one false. In Sri Lanka, mortality from dengue is low and morbidity is high. So apparently that is a better one than first. Because mortality low, that is correct. Morbidity is high, that is also correct. In Sri Lanka, morbidity from dengue is low, false. Morbidity high, mortality low. Okay, so if you analyze all these responses, now what is the correct one out of this? 1, 2, 3, 4, or 5? 1 or 2 or 3 or 4 or 5?
4.
Yeah, so mortality is low, but morbidity is high, right? Okay, now see, this is another type of a single best answer question. Now here also, there's no straightforward one false one. All are correct. You have to, all may be correct. You have to select the best one, right? What are the reasons why dengue is a challenge? Peak biting time, fly range, human preference of the mosquito. So you remember what we discussed. So all three are correct. Peak biting time, correct, but first one better than second one. Peak biting time and fly range, correct, but first one has another human preference also than these two, right? So first one up to now, first one better. Fourth one, peak biting time, fly range, human preference for mosquito, and lack of public health infrastructure. So in Sri Lanka, we are very much proud of our public health infrastructure. There's no lack of public health infrastructure. So this part false. Okay, so the fourth one false. Nighttime peak bite time, fifth one. So you know it's not the nighttime peak bite time. We told from 6 to 9:30 in the morning and 3 to 6:30 in the evening, right? So fifth one false. So from it appears that 1, 2, and 3 are correct. And out of the 1, 2, and 3, what gives the most information? 1 or 2 or 3? 1 or 2 or 3?
Answer 1, sir.
Yeah, answer 1, right? So seemingly the first one is better, right? Okay, so that is why, these type of questions, now if you go through previous exam questions also, you realize that there were some questions where all answers are somewhat correct, but you had to find best one. Whereas there were some responses where obviously four were incorrect, and straight away you can select the best one, right? So you have to get ready for both. Right. Okay, then let's discuss something on Sri Lankan healthcare system as the second component. Anyhow, these will be in detail covered. I again want to show you some sample questions. Okay, now since this is the first live session that we are doing, that I am telling you some theory before going into the questions, right? So in Sri Lanka, we have free healthcare. Okay, basically. There may be some instances where things are out of stock, and you may ask to buy something, but from time to time, but basically it's free healthcare where anyone can go and get any disease condition evaluated free of charge, right? Okay, so our health system can be divided as curative and preventive. Where ill people go is curative, where well people go to promote their well-being is preventive. Okay, for an example, pregnant mother without any disease is not a patient. Pregnancy is not a disease, right? So pregnant mother is not a patient, right? If the pregnant mother is having fever or whatever, then can be a patient, but pregnancy per se is not a disease, right? So pregnant mother will go for preventive services, not curative services. Okay, right. So likewise, people go for health services not only when they are having disease conditions. To promote their well-being also, they go for services, right? Right. So there are 3 levels of healthcare that we can discuss: primary, secondary, and tertiary. Primary healthcare means the type of services that should be available, accessible, and affordable everywhere, right? So you will learn them, in and out. So examples of primary healthcare are like that: treatment of common injuries, treatment of common diseases, antenatal care, vaccination, family planning, those type of things, right? So out of these, treatments are given in the curative sector, hospitals and primary medical care units. Whereas rest of the services are given from preventive services and basically by this MOH setup, medical officer of health officers, that you will learn, right? And for the curative services, we have three national hospitals, National Hospital Sri Lanka in Colombo, and then Kandian in Galle, right? Okay, and then other teaching hospitals, we have provincial general hospitals, district general hospitals, base hospitals, divisional hospitals, and primary medical care units, right? Primary medical care units provide outpatient care only, so no inward patients. From divisional hospitals above, we have inward patients, right? And from base hospitals above, we have consultants. So intern medical officers are posted from base hospitals and above, because intern medical officers are posted where consultants are found, right? Okay, so there may be an exceptional situation where in a divisional hospital, a consultant may be there. Now, when divisional hospital is about to become a base hospital, right? Otherwise, usually consultants are there from base hospitals and above, right? So the exam paper generally ask about usual practice, okay? If it's asked about some rare or exceptional thing, it will be mentioned, right? Okay, so if there's a question, consultants are generally posted to base hospitals and above, true. Okay, rarely you can find a consultant in a divisional hospital, that is also true. But that will be specifically mentioned in the paper, right? What is that rare instance? You know, divisional hospitals, when they develop, they become base hospitals. This process doesn't happen in one day, right? One consultant comes, then the second one, third one, fourth one, like that. I mean, then after some time, the nomenclature changes to a base hospital when the other requirements are filled. So in that process where divisional hospital is becoming a base hospital, there may be a consultant. Okay, but generally consultants are there, base hospital and above. Are the things clear? Are you all getting what I am telling?
Yes, sir.
Okay, right. So then this primary health care offered from all of the institutions, but divisional hospitals and primary medical care units only primary health care. So if there's a question, what are the primary health care institutions in Sri Lanka? For the curative sector, it is divisional hospital and primary medical care unit, right? Whereas MOH officers are there to deliver preventive healthcare services in Sri Lanka, and they are also given primary healthcare nomenclature because consultants are not there. So usually secondary care begins where consultants are there. Right. So you saw that in that syllabus that I showed you, now it has some section called Sri Lankan Health Organization under Central, Provincial, District and Divisional setup. So like that, I mean, we can discuss about the system under 4 levels, right? I'm not going to go into fine details today, but you will learn them, right? Okay, so like that at the central level, there are different staff categories, provincial level, different staff categories, regional level, different staff categories, and division level, different staff categories. So those will also come for questions also, and you will learn more on them later, right? And then under the divisional level, we have divided Sri Lanka into about 360 MOH areas. We say around 360 because the larger ones are being broken down into smaller ones. So this number increases, right? So ideally, we like to have 60,000 people in such an MOH area, right? And then the staff members who are there, we can categorize as supervisory and grassroots and maternal and child health and disease control, environmental and occupational health. So like that, different staff members are there, right? And then this MOH area is divided into public health midwife areas, public health inspect areas, okay? And the MOH office is in the middle, and there are various types of clinics. There's a central clinic and field clinics, right? Then public health midwives have their officers, public health inspectors have their officers. Then there's another structure called weighing centers where children after 6 months are brought to weigh. Barabaland, right? So those are called weighing centers, right? So there are particular equipment that are found there, right? So all those things you will learn in the community medicine. And the life cycle approach we told, right? So the maternal and child health services, there are services that are given for antenatal mothers, right, at the clinic, and as well as There are some services we deliver by going to the house of the people, right? And there are growth monitoring services. We weigh the children, we measure the length, weigh height like that. And well, baby, there's something called child health developmental record. Okay. Blue for boys and pink for girls, and there are various charts and everything that are there. So those will be there for the questions, and there are vaccination services that we give. Okay. And for school children, there's school medical inspection. So for well women, there's some screening kind of clinics, right? There are many family planning, contraceptive services, and services for subfertile couples. Okay. And for disease control, there's a notification system, right? Starting from a form called H544, right? And then there's a notifiable disease list. And you saw that there was a question, right? So you see that, I mean, there was a question that you all went through, and there were some responses asking what are the notifiable diseases. So you saw that malaria was there, measles was there, dengue was there, right? Okay, and then TB was there. Okay, leptospirosis was there, right? So you see that all are there in this notifiable disease list, right? You will learn this. And I told chikungunya not here, right? Not in this form, right? But currently it is notified. So that is why I told things are changing frequently, right? And there's something called this notification system where when we send this, there are particular things that are happening in the MOH officers, right? In order to control communicable diseases. And there are services for non-communicable disease screening, well-being clinics, and healthy lifestyle clinics. You will learn in and out about healthy lifestyle clinics. You saw that there was a question also. Then there are services for food safety. There are services for water quality. There are services for occupational health. Right. Now, if you go through one example, right? In each of the following curative health institutions, consultants are generally posted. Consultants are generally posted, right? Now, this is true, false. That means every response you have to mention as true or false. So, district general, yes, it is above base hospital. Divisional B, so what can you say? Divisional hospitals, we told generally consultants are there, base hospital and above. Base hospital and above, right? So, divisional hospital, the lowest level of curative institution was primary medical care unit. Above that, divisional hospital, right? So we told in those two, generally consultants are not there. So B is false. A is correct. C is true. C is correct. Base hospital, yes. District hospital, there is nothing called district hospital now, and there is nothing called rural hospital. Those days, there were several hospitals called district hospital, rural hospital, peripheral unit. That nomenclature is not there now. All these three are recategorized as divisional hospitals. Right? So anyhow, D and E in district hospitals and rural hospitals also, consultants are not there. Consultants were not there. Now you see the difference. A is district general. D is just district. So this is totally different. A means district general means having relatively higher facilities, right? District hospital means a type of a hospital that were there those days, and they were recategorized as divisional hospitals now. So consultants are out of these 5 consultants are found in district general and base hospitals, right? So are the things clear? Are the things clear?
Yes, sir.
Right. Then single best answer question. Example. Which of the following can be done only by the MOH, right? So there are services. Now, I am telling, don't worry about the content. We will cover those in these sessions, right? So what you should know is, I mean, that the principle behind this. So out of the services given by the MOH office, right? There are some services that can only be done by the doctor. Vaccination. If you get vaccination you will learn can be done by the MOH. MOH means medical officer of health. That is a doctor, right? And then there are additional medical officers of health. Okay. They also can vaccinate. Public health nursing sister also can vaccinate. Supervisory public health inspector also vaccinate. Supervisory public health midwife also vaccinate. Public health midwife also vaccinate. Public health inspector also vaccinate. So vaccination not only done by the doctor, right? Can be done by multiple staff officers. Screening for congenital heart disease. Now this needs stethoscope. You have to do the cardiac examination. So that apparently, yes, done by the doctor, but we'll see. We have to make sure that other four are less correct than the second one, right? Check in visual acuity. We use Snellen chart, and especially in school children, Snellen chart, so 6 by whatever. Now we measure something called visual acuity, right? Okay. That can, someone shows some numbers or letters, and then depending on what is the smallest type of letter that child can read, we give them their visual acuity for the left eye separately and right eye separately, right? So checking visual acuity, always you do not want a doctor, right? I mean, doctor also can do, but non-medical people also, trained people can check for visual acuity. Doctor will go through the finding, but checking for visual acuity, not necessarily a doctor be there. So C is false. Measuring the weight. Again, weight can be measured by PHI, PHM, SPHM, SPHI, PHNS, anyone, right? Doctor will better interpret that, but anyone can measure. False. Health education, everyone will do health education. Doctor will do in advanced manner, right? But anyone can do health education. So tell us what is the answer that you think as most appropriate? A or B, C, D or E?
Answer B, sir.
Yeah, answer B. Okay, right. So that is an example of the MOH setup, right? So that is what we wanted to discuss today, right? So we wanted to reflect on some aspects from the previous examination, and then some things about community medicine and how to get ready for the exam, and then some sample questions on dengue control and health system. So let me summarize again the exam format. So you see there are true false type of MCQs and single best answer questions. True false type of ones, you have to independently assess each question, okay, and then mark the response. And then single best answer, you have to, as a whole, you have to decide what is the best response. Maybe all other four responses may be incorrect, which will make your life easier. But in more complicated questions, all five responses will be correct, but you have to find the best one. Okay, so are the things clear? Are the things clear?
Yes, sir.
Oh, okay, right. Then our plan. In the system, there will be a theory section, right? And mock paper section. And then after you complete part 1, there will be a this OSCE section, right? And during the process, you all can now there will be a WhatsApp group and all. And any question that you have, and there will be an email also. So any question you all can either email or ask by WhatsApp. So any verbal response that you want, you all can just ask for I mean, you can ask. I may not be able to answer when you call, but if you fix the time beforehand, then if you have some, some clarifications that you think that you have some doubts that if you feel that talking will be better than going through a typed response, then that opportunity is also there. I mean, if you fix a time early, then at any question you all can discuss, right? So there will be email, WhatsApp, and voice calls. Okay. So any clarification you can make, and then go through these sessions, right? And as soon as possible, go through these sessions. And then by the time that you all are going through the session, we will wait for few more weeks, because if we put these last two sessions also now, what will happen is that there will be some more changes after those two sessions also, right? So we'll wait for some time until you go through the other sessions, and then we'll put the last two sessions also into the system, right? So it will cover all the changes that would have been done, let's say by mid-November. Okay. Okay, so we will delay the last two sessions as much as possible, but we'll ensure that you have adequate time for the preparation, right? Okay, so the last two sessions will cover the new changes. Inevitably, there will be some new changes, right? That's why I'm telling in community medicine, in 5 years, things will be, let's say 30% of the things may be different from what is there now. What is there now, right? Okay, so unlike other subjects, everything is changing, right? So COVID disease was there and we vaccinated. Now we are not doing COVID vaccination, and now there are no lockdown areas. Now there are no restrictions for dead bodies if they are suspected of COVID. Okay. Now there are no screening for COVID before any procedure, right? Okay. Now it is not mandatory to wear face mask, but anyone who wants to wear face mask, welcome to do so. It's optional, right? So likewise, depending on the circumstances, needs of the country, the public health related things change, right? So that is why. So I think you all are clear about our plan. Are you all clear about our plan?
Yes, sir.
Okay, then wish you all a great day. So any query you have, again, I'm telling email, WhatsApp, voice call, all the things are available. Okay, so then all the best and have a great day. And also, like, you all definitely can get through the exam in one go, right? Okay, then have a great day.
Thank you, sir.
Okay.